So our system in the UK, or our programme in the UK, is based on the US model. So back in 2003, the first US PAs came to the UK, and that was in response to a workforce crisis in the Midlands where they couldn't recruit GPs. And it was a nurse practitioner who said to her GP, "Have you heard about physician assistants?" And he went, "No." So they went to the States, they sought them out, they thought this is a brilliant idea. They recruited 2 US physician assistants to come to the UK to work. It went really well. And those US PAs were really the catalyst to what we have now. So they went along to some programmes and said, "Have you thought about starting PA programmes in the UK?" And I think initially they were sent away with a bit of flea in their ear and went, "No, we wouldn't do that." And then actually someone came back, and I think it was Professor Jim Parr at Birmingham, said, "Actually, do you know what? That's not a bad idea." And he was sort of converted. Okay, so we had 3 pilot sites, and we were called physician assistants to start with as well in the UK. And then we graduated 6 people from those pilot sites, and I was one of the original graduates here in the UK from the pilot site. And then those sites, one of the sites ran on into a full programme, continued from the pilot site into a full programme. And then Birmingham Wolverhampton came online in 2008, and then St George's came online in 2008, but in September, so they were in January. And then the programmes progressed from there. And then we went through a rocky patch in the UK where actually we were down to 1 programme at one point, and then 2, and then all of a sudden we have this really big crisis in medicine in the workforce, and not just in medicine, across the NHS. And we're looking about how then we can supplement that, or how we can augment that in physician assistants, where I think seen as part of that solution. And we're not the only answer. I think there are many solutions in the health service about how we make our system better to provide quality care to patients. But yeah, we were absolutely seen as part of that solution. And then Professor Paul sent some emails out to other universities around the country saying, "Are you interested in opening up physician associate programmes?" And they went, "Yeah." And all of a sudden we have this explosion from 4 programmes to 27 in the space of a couple of years. I suppose my role is pretty diverse in terms of, I started back in 2008 when the programme first started, and I've done practically everything you could do on a programme, you know, from teaching students to writing questions to examining to blueprinting to raising the profile to the external communications. Our students are incredibly diverse. We have gone from 11 students to 70, and that's taken 8 years. We're going into our 9th or 10th cohort now in September. We've graduated 8, we're about to graduate 9, we're moving into our 10th cohort. Yes, sorry, had to get my numbers right. And we have gone from 11 in our initial back in 2008 to 70 now going forward, and that's for both years of our programme, so 140 students, which is amazing.